I'm Risa. Welcome back to my channel. Today we'll be looking at one of the most popular mental illnesses, and that is schizophrenia. Today I want to shed light on how schizophrenia is diagnosed. Now, what I want to do firstly is point out the difference between schizophrenia and psychosis, because I found that a lot of persons sometimes confuse psychosis with schizophrenia. So psychosis really is when someone loses touch with reality. It's when they have a difficulty understanding what is real or deciphering what is real from what is not real. Schizophrenia includes psychosis, but psychosis is not all there is to schizophrenia. Okay, so today we're going to look at how it is that schizophrenia itself is diagnosed. All right, so schizophrenia, what is it? It's a mental disorder that impacts the mind, it impacts your emotions, and it impacts your behavior. Okay. So a lot of persons ask, what age group do you normally see schizophrenia, come into light? What age group do you normally see manifesting itself? And research has found that schizophrenia usually starts manifesting itself during late adolescence. The vast majority of cases in schizophrenia has been diagnosed between age 18 and 30. There's usually a peak onset of the illness during this time. Now, that doesn't mean that outside of these ages, persons won't be diagnosed. So to be clear, it's just that the vast majority of persons are diagnosed at this time. Okay? Now, in order for someone to be diagnosed with schizophrenia, the symptoms have to be in existence for at least 6 months. And the DSM has specifications as to what symptoms need to be present in order for schizophrenia to be diagnosed. Now, in order for schizophrenia to be diagnosed, there has to be both positive and negative symptoms. And I'll explain to you what positive and negative symptoms are. So positive symptoms. Positive symptoms refers to the fact that, or the symptoms that showcase that persons are unable to tell what is real from what is not real. So these are symptoms of perception. Negative symptoms, on the other hand, those refer to the absence of. So the absence of particular things, such as an absence or a lack of normal mental functioning involving thinking, behavior, and emotion. So you'll find that persons have for lack of a better word, deficit in the way they think, a deficit in the way they behave, or a deficit in their emotions. For schizophrenia to be diagnosed, there are symptoms that need to be present. A client must have at least 2 out of the 5 symptoms that I've listed. And one of them must be between symptoms 1 and symptom 3. So let's go into it. The symptoms are: number 1, delusions; number 2, hallucinations; number 3, disorganized speech; number 4, disorganized behavior; and 5, negative symptoms. So those negative symptoms are like flat affect, like you'll find that a person their affect, the way they relate, the way they feel is flat, almost seeming like there's a lack of emotion. There could be a issue with the way they speak, so there might be a void or some sort of deficit with the way they speak. So there might be some sort of deficit related to how they communicate. So now, the symptoms, delusions, hallucinations, or disorganized speech, the client has to have at least one of those in order to be diagnosed with schizophrenia. If none of those exist, Then there are other mental illnesses that can be looked at or evaluated to see what it is that the client may have, if any at all. Okay? So the client must have either delusions, hallucinations, or disorganized speech. Negative symptoms. And negative symptoms refer to the absence of. How do you know that it's schizophrenia? How you know it's schizophrenia is when these symptoms are seen in the manner that we've mentioned before. So it has to be one out of the first three and any other. So 2 symptoms in all. And in addition to that, it has to be persistent for over 6 months. I hope you have a better understanding of how schizophrenia is diagnosed and how schizophrenia is looked at in the mental health profession. I look forward to seeing you again on my channel. See you soon. Remember, like, subscribe, and leave a comment. Tell me what you'd like to see next. Have yourself a good day, and thank you so much for watching. Bye.